Welcome back in. Well, this time of year, if you have a stuffy nose, it's sort of a guessing game between is it allergies or more? And if it is allergies, are you doing everything you can to help yourself or even your kids from suffering? Dr. Noah Sutter is here to help us out from Nationwide. Thanks for being here today. Appreciate it. So, yeah, this is the time of year. We're coming out of cold and flu season, and we're still sniffling. Yes. So we're wondering what's going on.
Yeah, it's a gray area for us. We get a lot of visits that are just, is this a cold or is this allergies or is it something else? So it is tough sometimes to piece through, but there's some clues that we get with the symptoms in kids. One of the biggest ones is, especially coming out of flu season, hopefully coming out of flu season, allergies won't have fevers, obviously. Usually you don't feel as ill as you might with influenza or one of the other cold viruses that's floating around. So that's one kind of dead giveaway. No fever, no feeling poorly. But a lot of it is pattern recognition. Like, does this happen every year to you? Is it whenever, as they were saying, the weather gets hot, like the trees start blooming? Is it your season for sneezing, basically? So if it happens every year, it's a good chance that it's allergies.
So what can kids do? Because I know as an adult, I'm taking my over-the-counter, my Zyrtec, my Rhinocort nasal spray, all that good stuff. But can we give kids?
Kids can do most of the stuff that adults can do too. So again, if they have a history of every spring or seasonally getting these symptoms, you can prepare by doing some of those medicines ahead of time, and they actually work better that way. So if you know March is your time for allergies, then start now. Start with your Claritin, your Zyrtec, your oral antihistamines. If you have more significant symptoms or you tolerate nasal sprays, kids can certainly do nasal sprays like Flonase, Rhinocort, Nasacort, all those things too. So sometimes there's different versions for kids. So, as always, check with your primary care provider and make sure that it's appropriate for them. But yeah, now is when I start telling patients, start now before you feel miserable and you feel like your head's going to explode.
It's the worst, isn't it?
It is, yeah. And it's a lot easier to do things preventatively than to respond to all those symptoms later on.
Yeah, April might be too late, folks. You might need to get on it here in March because, we've got all the trees around here. They're going to start popping, and once they do, it's like,
those trees are going to start popping, and everything's going to be covered in pollen pretty soon. So if your history is tree pollen allergies, then the next couple months really is going to be important to address those symptoms.
So kids, I mean, we think about, well, are they too young to get allergies, or how young do kids really start presenting these?
So typically it takes a few seasons of exposure at least for kids to develop allergies. So usually 3, 4, 5 is early if you have allergies in the family. So if you suffer from allergies as a parent, keep an eye on your kids and see if they follow the same seasonality as you. But it's unusual to have allergies, seasonal allergies, before the age of 3 or 4 school-age kids. But then once we get into school age, it tends to get worse as you get older and you have more exposure to those allergens. So school-age kids can definitely feel it in the seasonal allergy realm.
So they don't get used to it, It doesn't.
No, it gets worse. But they're getting bigger too. So a lot of it is are the allergies getting worse before kind of we get bigger and grow out of that stuff, or are the allergies just so bad that they kind of get us all stuffed up?
Yeah, where's the point where it's like, oh, this is really, they have allergies really bad. I imagine they go in for their well checks, they chat with their doctor, and then from there they might have to go to
so depending on the level of like how much is it affecting your life. So if you've tried the over-the-counter antihistamines, if you've tried the nasal sprays already and they're still having significant symptoms, missing school or missing sports and stuff like that, then it's time to talk to the doctor and maybe even do some more testing, look into allergy testing or other stuff that can be done, because there's a wide range of things these days that can be really helpful for kids.
So if that's your kiddo, poor thing, but get it taken care of so they don't start missing out on all those fun things
for sure
that they want to do. So we're not quite yet to allergy season. We're very close. What are you seeing in the office right now?
So we're still seeing a variety of school illnesses. So influenza has been the biggest one. It's as you guys have put out there, the strongest flu season in 15 years or so. So it is really rough, and people are very excited to be done with cough and cold season, I will tell you. But we're still seeing a lot of colds. Some of the spring illnesses that we see, like hand, foot, and mouth virus, is starting to pop up. So we are starting to see those illnesses in addition to stomach viruses and stuff like that are still hanging around.
Oh, okay, because they are still cooped up inside to a degree, but hopefully we'll start getting outside and start sniffling for other reasons.
Yes, exactly. We'll take allergies over stomach viruses any day.
Yeah, that's no fun. All right, doctor, thank you so much for being here today.
I appreciate it.
Yeah.